So, my day-to-day clinical practice is I do trauma, critical care, and burn surgery. So I pretty much take care of people, when they're injured and on their worst day. And, a lot of our patients are victims of violence. And I had become involved in violence-related research many years before, actually, really in my public health training and in medical school, because I realized that we in medicine did not do a good job at all at, identifying victims of violence, understanding how it impacted their lives, and then actually helping provide interventions and supports. And I think it's maybe a testament to the values of NC State. There's a lot of us that have gone on to become physicians. And I think that, I was selected in part because of my work in violence prevention and intervention, and really trying to think outside the box and create a program and innovate in other ways to try to solve solutions to a very bad problem. I have colleagues back in North Carolina that are starting to do some of this work, and the reality is it needs to be done all over the place. And I think also it brings attention to the fact that there's a lot of people in different sectors, some of which I've mentioned: healthcare, public health, criminal justice, but also education, right? Child development, people that do urban planning and architecture, how we create our society, design our neighborhoods, design policy, how we educate. It all influences violence and the risk of violence and how we support victims of violence. And so I think it brings attention to the fact that we all actually have a role to play. And for people that are interested and inspired to do something about this problem, they have more opportunities than they probably think to help reduce the impact of gun violence in our society.